Hi everyone. So I got a great question the other day from a client of ours who has just found out that she's got a labral tear in her hip. And this was obviously a new diagnosis for her, and she was asking a whole bunch of questions around what does that mean. She'd done a little bit of Googling and had freaked herself out a little bit with what she read on Google. So I just wanted to, educate and give a little bit of perspective around what labral tears are, what need to be done about them, and what you can expect in the recovery process. So first of all, the labrum is the section that covers the socket of your hip, and it acts a little bit like a suction cap. The image I usually use when explaining the importance of the labrum to our physio students are that if you think about a glass that you put a little bit of water in and then put the same glass on top. So you've got two glasses stacked one on top of another with that little bit of water. Usually what the water does is create a seal, and it means that you can pick the top glass up and the water seal or suction will bring the second glass up with it. If you did that same experiment without the water and you had a dry glass and you put another dry glass inside, what usually would happen when you go to pick the top glass up is there's no seal, there's no suction, so you pick up the top glass but the bottom glass remains behind. The best analogy there is that the water that's acting as the seal is what the labrum is doing. So it's creating almost like a suction type seal to help facilitate the ball maintaining that nice contact with the socket. Now, what sometimes happens if you've been using your hip in a way where the function of the hip may be not optimal, or sometimes it happens from an acute accident like a car accident where the ball and socket joint get compressed together, is that after a period of time, if it's poorly aligned, that wearing of the ball on the socket can actually tear the labrum, that suction cap. That sounds disastrous. It's not disastrous. There's many people walking around with labral tears that probably don't even know they have labral tears and they're functioning just fine. What is important is to know where on the labrum that tear has happened and also the extent of the tear. So there are some places in the hip socket, if you get a labral tear, where it's not so much of a problem, and there are other places in the hip socket, if you get a labral tear there, it can be more problematic. Also, the extent of the tear is very important. So a very small tear, often you can get away with rehabbing it really easily and you may not even know it's there. Whereas a larger tear obviously has more impact on how the hip socket functions. So the first question that you always want to be aware of is, where is my labral tear? Is it in a sort of a good place to have a tear or maybe a not so good place to have a tear? And also the extent of the tear, like how big is the tear, gives you an indication of how much it's going to impact. All right, now the second thing to be aware of if you've had a labral tear and you know where it is and the extent of it is now to start to ask what kind of positions are alleviating, which gives us an idea of, are you able to get into a position that's comfortable? And if you are, this usually, gives us some positive vibes for how your rehab is going to go. Because if you can find a position of comfort, usually we can work with that position, strengthen around that position, and then work back to the non-comfortable ranges. If you actually can't find a position that's comfortable, then that gives us an indication usually as a physio, okay, this is maybe a little bit more of a challenging process, and we may start to already flag, okay, we might need to look at some more invasive procedures here. I always work with patients in that early stage to try and find alleviating positions. Sometimes that means taping up the hip or just educating them around the postures that they're using and the way they're sitting and standing, because more times than not, you can actually find comfortable positions, and from that comfortable position, work on healing the labrum. Now, when I say healing, it's not often that the labrum actually heals back over. It's just that the inflammation and aggravating, inflammatory indicators in the hip will start to reduce over time. It's not that the labrum actually re-heals, it's just that it's no longer aggravated. And you can often get back to functioning with your normal activities of daily living. If you're in that very unlikely category where you may actually need some kind of surgery, then that is an option. There are a whole bunch of different surgeries, from very non-invasive type surgeries to quite invasive type surgeries, to be able to, provide comfort back to the hip. None of them at the moment actually, again, fix the labrum. Most of them are going in and sort of like debriding, taking out pieces of the labrum that are, irritative. So that is an option, but it's a fairly invasive option, and most people actually don't need that option. So if you've gone on to Google and you've started looking around and you think you have a labral tear and you've freaked yourself out a little bit, the good news is that most labral tears can be rehabbed very, very, very well and in a very conservative manner. And if you're unfortunate enough to have one of those types of labral tears where you may need surgery, there are some great surgical options, and I would encourage you to really work closely with your physiotherapist and your orthopedic surgeon to make sure that you get the right surgery, and also the pre-rehab and the post-rehab that you do is very effective. So I hope that was helpful. That might give you a bit more insight around what a labral tear is and what your options are. If you have any questions, as always, you can comment below. If you want some information that may be more specific to your own individual needs, you can always give the girls a call. We've got studios in Caringbah, Alexandria and Helston Park, and a whole team of highly experienced physiotherapists and Pilates instructors who see labral tears all the time and know exactly what to do with them, and they'd be more than happy to give you some advice and work with you potentially on your rehab. All right, guys, that's all from me now. See you later. Bye.